On this Thursday night, records shattered in Canada's COVID hotspots. Are tighter restrictions coming? Plus, the drastic measures in one Ontario region.
This is life and death.
BC's COVID hospitalizations hit an all-time high. And in Alberta, more students move to online learning. A big shift. The federal Conservative leader puts a price on carbon.
It is not a tax.
It's a tax.
And heartbreaking memories and searing grief.
We are reliving the immediate pain that we felt.
How Nova Scotians are coping a year after a mass killing.
Global National with Donna Friesen.
Good evening and thanks for joining us. The worst predictions about COVID, ones we've been reporting on since early January, are now playing out in parts of Canada. The third wave is driving up case counts higher than they have ever been. National daily case counts are rising steeply, exceeding the first and second waves, and these numbers reflect transmission from 2 weeks ago. Canada's top doctor says things may get worse before they get better. Ontario, BC and Alberta are leading the way. There is talk in all of them of tighter restrictions. Ontario is considering a province-wide curfew. Here is why. More than 4,700 new cases were reported in Ontario today. It has never been that high, and people are dying in greater numbers. 29 deaths reported today. 659 people are in ICU, and that is more than ever before. Premier Doug Ford's cabinet is debating imposing tighter restrictions, potentially a curfew, and there is growing consensus something has to be done.
Things are not going to get better. If we don't change what we're doing, things will in fact get worse.
The situation in one part of Ontario is already spiraling out of control. The health unit in Grey Bruce, that's northwest of Toronto, is warning every resident there to consider themselves a COVID-19 carrier and telling them to stay home for the next 48 hours. Kamil Karamali has our top story tonight.
Few pedestrians, even fewer cars. This is what it looks like when a region's number of COVID-19 cases surges past its breaking point. Total shutdown.
I think this has sort of relit the fear and got people thinking about it.
The Grey Bruce Public Health Unit, just a couple of hours northwest of Toronto, usually sees fewer than 10 new COVID-19 cases a day. But now it's hit more than 70 new cases in just 36 hours, leaving residents and local business owners worried.
We're absolutely terrified that our employees are going to get sick and infect their loved ones.
The public health unit says the source of the rapid transmission is residents not following lockdown rules, people visiting other homes, social gatherings, and so-called bush parties held by high school students. What's made matters worse, people lying when they're asked about contact tracing, which is why the surge in cases caught everyone so off guard.
Please, if you get contacted by the health unit, be honest with them about who you've been with, where you've been. Don't try and hide it from yourself or your parents.
The public health unit is now asking all 160,000 people under its care to consider themselves a COVID-19 carrier for the next 2 days until they can reach all the cases and contacts on their list. That's nearly 500 people.
There are two situations or two clusters in the community related to younger people partying after hours, not related to the school per se, and that really generates many cases.
Kamil Karamali, Global News, Toronto.
In BC, more people than ever before are in intensive care now, and case counts keep rising. The idea of new restrictions is being floated there too. The province recorded more than 1,200 new cases today, driven by infections in younger people. New modeling shows case numbers have increased across nearly all age groups, particularly in age 19 to 39-year-olds, shown in green on this graph, and 40 to 59-year-olds shown in the red line.
This is a different game right now. The restrictions, this concept that we're in the end game and we can let things go and we can make exceptions for ourselves are things that we all need to pay attention to again. The end is coming, but we're not there yet, and we're going to see the impact tragically on the people we're closest to if we don't pay attention to it now.
Global BC's Legislative Bureau Chief Keith Baldrey is with me from Victoria. Keith, younger people getting sick in BC. Health officials, though, still saying schools aren't a big factor. Are more restrictions likely then?
Yeah, interestingly enough, today, Donna, we were given some new data from studies of Metro Vancouver schools showing that by and large, schools are not where the virus is being transmitted. It's being picked up in the community and then occasionally brought into school. But schools aren't going to close, and the presentation made it very clear today why that's going to be. Also, interestingly today, Dr. Henry reminded us of her three guiding principles in this pandemic. Number one was keeping the number of people dying at as low a number as possible. We are succeeding to a large degree on that. We have one of the lowest per capita death mortality rates west of New Brunswick. Secondly, prevent our healthcare system from being overwhelmed by COVID. Even though we have a record number of hospitalizations and ICUs, they have yet to overwhelm the system. And finally, and she reminded us of this, and this goes to restrictions. She says she wants minimal disruptions to society. That's why BC's never had the level of restrictions we see in Ontario and Quebec, and that's one big reason why I don't think we're going to have much more restrictions than what we currently have here in British Columbia.
All right, Keith Baldrey in Victoria, thank you. Well, Alberta still leads the country in the number of active cases per capita. Infection levels are so high among school-aged kids that Calgary's two largest school boards have decided all classes from grades 7 to 12 will move online on Monday for at least 2 weeks. The Premier has added more restrictions as case counts continue to rise. Heather Yourex-West reports.
For Carolyn Chin, hearing that her two high school-aged kids would be returning to virtual learning came as a relief.
If you consider it in high school, there's no way you can maintain social distancing of 2 meters.
Starting Monday, all junior high and high schools in Calgary's two largest school districts will move online for 2 weeks. The Calgary Board of Education has more than 6,000 students and staff in isolation.
What has happened is that since March, coming back after the spring break, we've seen a significant increase in positive cases in our schools.
The number of cases per capita is rising quickly among school-aged children and is now higher than its previous peak in early December. The age group now has among the highest number of active cases, second only to Albertans aged 20 to 29.
Although transmission's happening in the schools, much of the virus is also being acquired in the community.
It's why Alberta Health is now also requiring that all youth sports and performance activities in Calgary either pause for 2 weeks or move outside.
I would ask that all parents and students continue making safe choices and remember that social activities outside of school can easily spread the virus and put schools at risk.
With daily case counts on the rise, Dr. Dina Hinshaw says further restrictions may be required soon to protect the province's health system from becoming overwhelmed.
What we're seeing more commonly now than we saw in the first two waves are patients that are younger, in their 20s, 30s, 40s, that don't really have any health problems. They're coming in healthy with severe COVID, ending up fighting for their life on a ventilator.
This week, Alberta Health said the youngest patient in intensive care was just 15 years old. Heather Yourex-West, Global News, Calgary.
The capital of Nunavut is now under strict lockdown after confirming its first case of COVID-19 since the pandemic began. All schools, non-essential businesses, and government offices in Iqaluit are closed. Residents are being urged to stay home and limit contact with people outside their households. Masks are now mandatory. Nunavut's main airline, Canadian North, says the infected individual is one of its employees and that contact tracing is underway. A public health emergency in Nunavut was extended today until April 29th. Well, vaccines can't roll out fast enough to protect Canadians, and today there's news of another delay. The military commander leading vaccine logistics in Canada says 1.2 million doses of the Moderna vaccine that was scheduled to arrive next week won't get here until the end of April or possibly the first week of May.
We're fully aware that provinces are making adjustments, and we're trying to narrow this down as much as possible so that they don't find themselves in a situation where they have to constantly react to perceived delays.
He says 855,000 Moderna doses that were supposed to arrive last week arrived earlier this week. Fortin also says Ottawa is working closely with Moderna, which has agreed to narrow its delivery cycle to Canada from 3 weeks to 2 weeks. The Conservatives have a climate policy coming up, what Erin O'Toole revealed today about putting a price on carbon. The political divide in Canada over carbon pricing got a bit smaller today. Conservative leader Erin O'Toole unveiled his party's plan to tackle climate change. He promises to regulate large industrial emitters, introduce zero emissions vehicle mandates, and adopt a national clean fuel standard. The biggest shift, though, is that O'Toole agrees it is time to put a price on carbon, a policy he has opposed until now. David Akin explains.
Vehicle mandate. Just like every other major party, the Conservatives now agree pricing carbon is key to cutting greenhouse gas emissions.
We recognize that the most efficient way to reduce our emissions is to use pricing mechanisms.
That's a major switch.
It's a big day. The Conservatives have presented a plan that can credibly meet Canada's current Paris Agreement target to reduce emissions.
O'Toole would replace the Liberal carbon tax and rebate program with a Conservative low carbon savings account.
This plan scraps Mr. Trudeau's carbon tax. This is not a tax, not a cent goes to Ottawa.
But consumers would still pay a carbon price at the pump, a price which would earn a consumer credit in that carbon savings account. Then the consumer uses the credits in that account to buy items from a government-approved shopping list of things that could lower emissions: a bus pass, a bicycle, a home energy retrofit. By contrast, the Liberal carbon tax rebate can be spent on anything.
The Conservatives want to sell their carbon pricing scheme for households as a savings plan, but it's not a savings plan, it's a tax with restrictions on how households can spend the money that they get back.
But the big news here is that the leader of the Conservative Party of Canada agrees that putting a price on carbon is the way to cut emissions. That's a first. Now the big question, will that start to attract some new voters to the Conservatives? And perhaps a bigger question, with groups like the Canadian Taxpayers Federation denouncing this as a straight-up carbon tax, can Erin O'Toole get Conservatives to get behind his plan? Donna?
Pretty interesting stuff. David Akin in Ottawa, thanks. Still ahead, blood clots after COVID vaccines are extremely rare. We hear from a survivor about her symptoms.
You're watching Global National.
There is some important perspective about the risk of developing blood clots related to COVID-19. Researchers at the University of Oxford report the risk of developing a rare form of blood clotting is much greater if you get COVID-19 than if you get a vaccine to protect yourself from the virus. The report says blood clots are reported to occur in about 5 in a million people after the first dose of the Oxford-AstraZeneca COVID-19 vaccine. It found the risks of the rare clots from COVID-19 is about 8 times greater. The study has not been peer-reviewed. It says those numbers could change because the data, of course, is still coming in. What is certain is that this blood clotting disorder is exceedingly rare. About 200 million doses of AstraZeneca have been given around the world, and about 200 cases of serious blood clots have been reported. But it is wise to be aware of the symptoms. Yesterday, I spoke with a young woman in the UK who just got out of the hospital. Lauren Briggs is 32 years old, mother of 2 young children, and lives in Flintshire, Wales. She had the AstraZeneca shot on March 25th, one of more than 20 million people in the UK who have been given that vaccine. By the end of March, 79 people had developed rare blood clots, and 19 of them died. Lauren is alive and well now, but went through a frightening experience. Lauren, thank you so much for talking with us. You started feeling ill 10 days after getting the AstraZeneca dose. Can you describe the symptoms and what you noticed that made you go to the hospital?
I started with a horrendous headache. I was really breathless. I had a high temperature. So worst case scenario for me personally was that I thought I had COVID, which I'd not had before. So I went that evening to get a COVID test, which come back negative. And that evening I noticed that I had a horrendous pain in my left leg, like in my calf.
So you were sent home, given a blood thinner and sent home. What happened next?
I got a phone call on the Wednesday morning to go back to the hospital for a CT scan on my lungs. I still wasn't feeling well. I was probably sat there for about half an hour. And then a member of staff came over to me because I was crying again, because I was in a lot of pain and I was obviously worried. I got put into a side ward, into a bed, and literally about 5 minutes later, 2 doctors and a consultant came over to me. And then he said, basically, you have blood clots on your lungs and we assume it's from the AstraZeneca vaccine. At this point, I broke down in tears because I was really, really worried. I'm only 32. I've got a 4-year-old daughter and a 2-year-old son. And to be told that I had blood clots on my lungs, which is deadly, was scary. And I did actually ask him, am I going to die? And he said, we need to start treatment as soon as possible. After all these tests, it come back that the blood clots were in my leg. I think they presume that that's where they started, and then they travelled to my lungs. Luckily, there was no blood clots on my brain.
You're still waiting to find out if it's officially related to the vaccine, but the doctors who you have seen so far certainly suspect that.
On my discharge notes, it says vaccine-induced thrombosis and thrombocytopenia. Every single doctor that I've seen has said that they've never, ever seen this. It's a kind of blood reaction and clots and things in anyone.
You should, in theory, be getting a second AstraZeneca dose. Obviously, you're not going to do that, right?
No, my doctor advised me not to get that because I would end up in hospital again. It's not something that you ever think that is going to happen to you.
Lauren, thank you so much for sharing your story with us. And glad you're feeling better, and I hope it improves much more. Thank you so much.
Thank you.
And you can watch my full interview with Lauren on our website, globalnews.ca/globalnational. Next, the agonizing anniversary in Nova Scotia as memories of the mass killing are still raw. It has been a year since a rural community in Nova Scotia found itself in the middle of a nightmare. A gunman disguised as an RCMP officer killed 22 people in a 13-hour rampage. It began in the tiny village of Portapique on April 18th and ended the next day when the killer was finally found and killed by the police. As a dreadful anniversary approaches this weekend, Nova Scotians are still struggling. Ross Lord reports.
After a year of grief and despair, some symbols of strength are emerging for communities devastated by the mass killings, like this steel monument created by a man whose stepson, Corey Ellison, was murdered, along with 21 others.
When I say in the poem, you're still in a part of our heart and our mind, we can go back to that, but we still have to live and go on.
Nearby, there's a series of memorial markers honoring the victims and intended to ease the pain of a murder spree too horrific to ever be understood.
I have a good friend who lost a very close family member, and she's had a hard year.
It's senseless. Senseless. There's no rhyme or reason why somebody would do that. It is in this day and age, in Nova Scotia.
Healing collectively is complicated, especially with pandemic restrictions. Just ask those whose job it is to help, like Pastor Stephen Adams.
Those things are really important, and it's the ability to be able to connect with other people, and it's been made a lot harder.
Pastor Adams says there's no shortage of goodwill.
I know there are a lot of people that care and a lot of people that want to help, and that's a good thing. That's always a good thing.
For victims' families, including schoolteacher Lisa McCauley's sister, April 18th and 19th mark a dreaded first anniversary.
Oh, it's agonizing.
Those dates trigger horrific memories.
We are reliving the immediate pain that we felt.
Jenny Kierstad says therapy has helped her cope, but there are questions about how the Nova Scotia mental health system has responded in rural communities that were devastated by the mass killings.
There's a fragmentation. I guess I would say it's fragmented, and that's really had implications, I think, on the community, and it will moving forward as well.
Serena Lewis lives in Great Village next to Portapique. She just finished a term as Nova Scotia's Grief and Bereavement Coordinator. She suggests traumatized communities need a more concerted effort.
This is a specialized team of people that are going to come to the communities, meet people where they're at, and try to build this foundationally from the ground up.
The need for support is far from over. Mental health counselors say for some people, the after effects of extreme trauma can become even worse in the second year.
There are new stopgaps, like Nova Scotia psychologists offering 3 free sessions per person to those most affected.
I've received about a dozen calls so far. There are people who didn't reach out originally because they thought they were okay.
Even a year later, these are early days in the aftermath of something so hideous and so shocking. Ross Lord, Global News, Debert, Nova Scotia.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is Ardrossan, Alberta, just east of Edmonton. Thanks for watching. Robin Gill will be at the anchor desk tomorrow, and I'll see you on Saturday for the new reality. Take care of yourselves. Bye-bye.